Hi, this is Dr. Santana again from Wall Holistic Medicine. So, I wanted to talk about how holistic medicine actually works. So, there's some people have some idea of it. They're like, yeah, it's natural, but it's good for you. But what does all that stuff mean? So, what does good for you mean? Well, first of all, I just want to say that it was dispel the idea that there's anything that's good for you. Some stuff, it's all situational. That's the thing. It's all situational. Like people say, like if you followed all of the things, let's look at it this way: if you followed all of the things that are good for you, where would you be? So let's see, what's good for you? Putting garlic oil in your ears and salt water in your nose and eating nothing but kale and eating raw foods, but eating raw meat, but eating cooked meat, but eating sushi, but not eating sushi, but not eating any meat. All this stuff is good for you. So there's a lot of conflicting information out there. What do I do? That's a brilliant question. And here's the thing: there's something out there that works for you, and it's probably right under your nose. And you need somebody to help you explain it to you. You need somebody to help you sort out: is this a good idea for you? Is this a bad idea? So, case in point, I have an example. So, I have this patient who came to us snoring like all the time. We had to go look at his diet, right? So we had to look at his diet. We had to see what's going on and to see what foods are aggravating that situation. And it turns out he was having papaya, banana, and yogurt for breakfast with coffee, right? That's healthy, right? Everything in there is how, coffee is healthy, coffee's not healthy, drink coffee. Okay, so there's healthy, there's not healthy, good for you, there's bad for you. There's all of that. Breakfast theoretically is healthy, but it's actually contributing to his snoring. It's why he's snoring. That's the reason that he's snoring, is because of that breakfast. So we gotta tell him, look, it is healthy, it is good for you, but it's not good for you, and it's not healthy for you right now. That will change. But for now, you gotta cut that out, because otherwise your wife's gonna keep elbowing you in the ribs. So do you want elbows in the ribs, and do you want to have a healthy marriage, right? Or do you want to have yogurt for breakfast, or do you want to avoid all of the other stuff that goes along with snoring with your partner not being able to sleep? So looking at that, learning from that, and just kind of adapting and saying, okay, that is what it is. Healthy, right? What is healthy? What does that mean? Healthy would mean healthy is a state of what, like, how you ask people about health, like, what does healthy mean? There's gonna be hundreds and hundreds and hundreds of definitions of that everybody's gonna have a different idea of what that means. So when you say, oh, I do that because it's healthy, what does that mean to you? What does that mean to you? Because you saw that somebody said it's healthy, that means it's healthy. So I'm not judging anybody on this, and I do this. We're all human, right? We all do this. We all see, oh, that must be healthy. We have these preconceptions about what health is, but we actually need to look at them and say, is this really healthy for me right now? Is this the right thing for me right now? As they say, a little bit of information, a little bit of knowledge is a dangerous thing, right? A little bit of knowledge is a dangerous thing. So I know, yeah, we all have Google in our pockets, which is great, but it's very easy to impulsively jump to a decision that something is good for you and healthy for you, and not necessarily have the wherewithal to know, or the training to know that maybe it's not great for you. So you just need someone to explain it to you. I'm still there. Like there's this spot on my back that I can't scratch, right? I can't be my own dentist, right? We all need somebody to help us get to that spot that we can't reach, right? Which for some people, it might be, why am I snoring? I can't really figure it out. My shoulder hurts. I can't figure it out. You need somebody to help you, right? So it's not a big deal. So how does holistic medicine work? How does holistic medicine work? What is it? So holistic, meaning treating the whole person, top to bottom, inside and out, and looking at each individual person saying, you are a unique metabolism. You are a special metabolism. Nobody else's metabolism is like you. How does it work? How does your metabolism work? How is it different from mine? Right? So looking at you and saying, this is how I work. This is what works for me. This is what doesn't work for me. And having a practitioner who works with you and says, okay, does this work for you? Does this not work for you? And being able to work together and come up with a plan, right? I made the analogy earlier about like shoulder, right? You throw at your shoulder. Oh, I hurt my shoulder. Ow, I was playing badminton. I hurt my shoulder. Well, why did your shoulder hurt? Well, I've been playing badminton with that arm for 10 years. Okay, that's a repetitive stress injury. So now that we know that we have to address lots of use on that joint, we need to rejuvenate. We need to bring life and youth there. We need to bring new circulation there. We have lots of ways that we can go about doing that. We had another patient come to us, and she was having a situation where the pandemic came and she was trapped in a tiny apartment with her husband, and they were having a really, really rough time with the relationship. They wound up getting divorced. But in the beginning of that relationship, she was having crazy digestive issues, which we know as traditional East Asian medicine practitioners is a condition called U syndrome, where you repress your emotions and you just say, I'm not going to let that out because then my whole world will fall apart, right? She wanted to keep her family together. She wanted to not, the world's all the stress. The stress wasn't expressing herself, so she just held on to it. So what happened? She had diarrhea like 10 times a day. Poor girl had diarrhea 10 times a day. Oh my God, can you imagine? So what did we do? So we went in and we treated some of this emotional stuff underneath. We helped her get off this medication that was making the situation way worse. She couldn't afford it anymore, so she's like, I can't afford the medicine. I'm gonna go through this weaning process. I'm like, we don't know. She's like, I don't know what to do. I'm like, come, we have some herbs. So we gave her some herbs. We gave her acupuncture. We worked with her for about 12 weeks, and she came out the other side. She got divorced, which is, it is what it is. That relationship wasn't working, so they went their separate ways, and it's not my place to make a judgment call. I just need to make the person who comes to me to be healthy, right? So we got that person to be through that hard situation in their life. We supported them there. We supported them with the diarrhea. They stopped having diarrhea every day, and then she stopped having what was the other thing? And she stopped having these crazy withdrawal side effects from the drugs. So all of this, so we had to look at her and say, what does the whole picture of her life look like? Who is she as a person? Who is her metabolism? How does her metabolism work? We had to triangulate what's going on, try to find that one little bit in there that we didn't need, right? That one little bit that was the one domino that in her metabolism that when we knock it over, everything else would get better. So we try to find that. And that's kind of how holistic medicine works. Let's look at the whole body. Let's look at the whole person. Let's look at why are you this way? Well, I have digestive issue right now. Why is that? Were you on antibiotics a lot as a kid? Oh my gosh, antibiotics were great. Brilliant medicine. Amazing. Where would humanity be without antibiotics? But how many times have you been prescribed a probiotic with an antibiotic? I'll bet you 0. Maybe once if you found a naturopathic physician to prescribe you antibiotics, right? I was on antibiotics a lot as a kid. I had recurring ear infections, recurring throat infections as a kid, right? It's what happens for kids. How often as a kid was I given antibiotics? 0 times. I had skin issues, I had digestive issues, I had weight gain issues, I had weight loss issues, I had lassitude, sleepy, fatigue issues, all this stuff. And I think a large portion of it was due to not having taken a probiotic and having destroyed my digestive tract. And you know that if you don't have the right biota in the soil, plants don't grow. You know if you don't have the right gut biota, then you can't digest food. You get bloated, you store food. We know that our bodies, we have different bacteria on our hands than we have in our arms, than we have in our faces, than we have in our mouths, than we have in our digestive tracts, than we have in our colon, than we have in our stomach, than we have in our hands and feet, right? There's different bacteria that occupy all of these spaces. So we have to be sensitive to the fact that maybe a lot of these other issues that are coming up, digestive issues, emotional disorders, hormonal disorders, maybe a lot of that stuff has to do with antibiotics and not being on probiotics, right? So now we got to look at your whole health history and say why. Another case in point, right? Looking at the whole person. We had another patient who came to us. Wonderful person. She comes to us and she says, well, I have had this jaw pain when I was a kid. I had these wisdom teeth, and she got all 4 of her wisdom teeth removed, and she's had TMJ ever since, which we know as East Asian medicine practitioners, East Asian medical practitioners, that if you have a stretch or strain or a sprain in any muscles and tendons and sinews in the body, when you have a strain and a stress on that, you'll develop a condition that's known as blood stagnation, where blood pools in the body and makes it harder for the muscles to be soft and supple, right? You want your musculature to be soft like a baseball glove, right? Soft, supple, enough hydration to the tissue, right? Enough moisture in the tissue, enough suppleness in the tissue that has flexibility. But what happens in cases of injury, especially acute injury, especially in surgery, is that you have this blood stagnation, you have the tendons will get inflamed and stuff like that, and it gets gets tight and it gets a lot. And people get that TMJ, they get that tightness in the jaw right there, super tight. So we have to get in there with our needles. We have to get in there with our thumb and massage. We have to get in there with our herbal liniments to open and to open the capillaries, to bring blood circulation there, to clean the area clean, and to clean the accumulation of blood in there, bring new fresh blood to the tissues, new fluid to the tissues. We need to be soft and supple rather than hard and indurated. And desiccated, right? So we need to fix that. So looking at that, I thought that TMJ to me is a no-brainer because I have the paradigm to be able to look at that and say, I know. Oh, and then what happens when you get your wisdom teeth, right? You put ice on it. You put ice on it for weeks, right? You eat ice cream so it gets cold from the inside, cold on the outside. And what do you do to dead bodies? You put them on ice so they don't rot. So what happens when you put water in the freezer? You go, it expands a little bit, it gets tight, there's a lack of movement. We know that when you look at the molecules of water under a microscope, they go from being liquid to being icy to being, they can't move so much. There's less movement. So when there's cold, there's less movement. How is that different for blood circulation in the body? Now, cold is great because it cuts that pain down. It cuts that pain down to like a fraction of what it could have been at the expense of circulation. So it's not inherently bad to ice a joint, right, in an injury, but icing and never bringing warmth. The best, in my opinion, the best way to go is ice and then warmth, and then ice and then warmth. So we need to bring that warmth back in. Oftentimes that we'll do it with warming and circulating herbal medicinals, topical or internal. But if you're alternating ice and heat and ice and heat and ice and heat, you're going to have less of that stuckness, less of that hardness, less of that tightness over time. You don't have to believe me, it's a thing. And if you come in and your shoulders hurt because of that, I'll show you that it works. It's just a thing. You don't have to necessarily understand intellectually. Well, it's easy. It's actually easier than a lot of the traditional East Asian medical concepts to wrap your head around because it's thermodynamics, right? And we know that when you get hit, you get a bruise, blood pools and blood clots. There's blood stagnation right there. You have a traumatic event, circulation is interrupted, healing factors come to the site and they create clotting, there's blood stagnation. Of course you need clotting for tissue to regenerate, but there's your blood stagnation, there's your lack of circulation, there's your tightness, there's your hardness, it's right there, it's thermodynamics, right? So how does it work? We have to look at all this stuff. We have to look at the whole person, holistic, right? Holistic, like a mirror view on the screen, holistic medicine, right? That is looking at the whole person. This is where medicine has come from. It's sort of lost a little bit of sight of that in its, over the last, however long. That's up for debate, but we're going back there now. The natural food movement, the organic food movement, people growing food in their home and farmers markets, all that kind of stuff. It's coming back. We're going back to that. We're going back to our roots. We're trying to embrace the island. We're trying to bring staple foods back to the island. We're trying to decrease our food dependence. That whole movement, this whole movement is all tied together. That's the holistic movement. So the world is moving that way. We have to move that way to survive. Otherwise, our species won't survive. But also, it just works to go that way. So we're going that way anyway. So anyway, enough of that rant. I hope it wasn't too soapboxy and that there was something that you could take with you to know that, like, okay, this paradigm, this medicine paradigm, this way of looking at things has some tools that that can help me to get to a place that's better, to where I feel better, to where I have better quality of life. And if you were in less pain all day long, you have more focus. And when you have more focus, you have more chi. And when you have more chi, you can change your life. When you have more focus, right? More barrels in your bowl, as they say. When you have more, when you're there, right? When you're all there and all present, you can make changes in your life. And you can make your life better. And you can figure out how to make more money. And you can problem solve better. And everything else in your life gets better. But pain clouds judgment. Pain clouds your mind. So as we pull away these layers of pain, all this other stuff is going to come to the surface, and you're going to be able to start to clean house and to have new insight into your life, and your life will change dynamically for the better. I promise you that. I guarantee you that. It's just the way that it works. So anyway, thank you for listening, and I hope you got something that you could take with you and ask us any questions you want. Looking forward to speaking. Bye, everybody.